Let's get into that big story that's been going around that everybody can't stop talking about. Newsweek reports White House says crack pipes never included in safe smoking kits. I think this story is particularly interesting to me because I can understand wanting to intervene to help people who are addicted to drugs, to lower drug infection rates, to get them into safe environments, and help them get off drugs. The problem I have with this story is that, for one, I think the White House is lying about not including crack pipes. And I think giving crack pipes to people or meth pipes and other drugs, syringes, will just increase the amount that they're actually doing. So I just want to mention one thing in reference to this story. If you do a Google search and look up harm reduction supplies and safe smoking kits, glass stems, crack pipes, and meth pipes are typically included in them. Now that we've gotten that out of the way, I don't know if our good friends from Congress have any insights into this story or what was going on. Is it true? Is it false? And what do you think about it?
I would like to say that fact checker itself, I reject the phrase. I mean, it's a synonym for corporate shill or leftist propagandist.
Amen.
So that's my take on fact checkers. I wouldn't believe a word they say.
No, I don't believe a word they say either. And actually, I find it appalling that Joe Biden and the Biden administration would give out crack pipes in these safe smoking kits. You know, we do want to see people get off of drugs. I think that's extremely important. But I think Biden doesn't care about drugs. He doesn't care about people dying. Fentanyl is coming across our border at a terrible rate. Fentanyl poisoning is now the number one cause of death of ages 18 to 45 years old. And so Joe Biden's all for drug use, right? He's all for fentanyl. He's all for smoking meth, smoking crack, whatever it may be. It's absolutely appalling. But the one thing he doesn't support, the one safe drug he doesn't support is ivermectin. So I think this is a serious problem.
Well, as always, people should be getting medical advice from trusted medical professionals. And I don't care if it's a politician. I don't care if it's a celebrity. You got to get that advice from somewhere else. The part of the story that makes me laugh is, okay, let's just say for a minute, all right, there's no crack pipes here, right? They've denied it. No crack pipes. Does the safe smoking kit include meth pipes then? Because that's typically involved. The issue is, even Snopes acknowledged the point of this program is to give priority to minorities to smoke these drugs. So that means that think about this for 2 seconds. Like, the Biden administration is basically saying we're going to be funding programs that distribute drugs and drug paraphernalia to minorities. I don't think that's going to solve the problem of racism.
Are they actually distributing drugs as well, or is this just a paraphernalia program?
I think it's paraphernalia. Okay. To make sure that's clarified, like syringes and stuff like that. But if, like, I'll put it this way: if there's like a white dude and he's a drug addict, there's like a black dude and he's a drug addict, and your program says give the supplies to the minority, that means you're going to have less white people doing drugs and more minorities doing drugs. That sounds awfully racist and
or more
horrifying.
More white people getting sick from dirty needles, and that's also horrible.
Wait a minute. We haven't voted on any funding for this. How are they doing it?
We've given them broad swaths. I don't know how they do it.
I don't remember reading this in any bills.
We have voted on one thing, though, in our Judiciary Committee, and that is to make sure there's parity in drug sentencing laws between crack and powder cocaine. Because in the beginning, it was actually the African-American communities who wanted maximum sentences for these evil people that were destroying their communities for crack.
They should.
But then they decided that it was racist to over-prosecute crack in comparison to powder cocaine. So a lot of states have made parity between the sentencing laws between these two. And so we've had votes in Congress to restore parity to get rid of any racial bias.
I don't think people should be going to prison for doing drugs. I think they need help. I don't know. How do you guys feel about that?
I think drugs are so destructive. I mean, like I said, right now, the drugs that are coming across the border at just a record rate through the Mexican cartels are laced with fentanyl. And if young people are dying, if the number one cause of death for young people is fentanyl poisoning, I think drugs are a real problem. I really do.
Is it number one?
It's number one.
Wow.
Number one cause of death. It's not COVID-19. It's fentanyl poisoning.
Now,
Wow.
I think we have the constitutional authority to regulate it at the border. Mm-hmm. But let's be honest, when they wanted to outlaw alcohol, they recognized at the time they had to do it through a constitutional amendment. So states might be able to do this and the feds might be able to do it at the border, but I don't think we have the constitutional authority to ban substances at the federal government level.
Yeah. I mean, honestly, I agree. I think, the problem is, we talked about this a bit last night. We want people to not do drugs. And so personally, I think locking people in prison for imbibing something sounds really, really awful, especially if it's something hurting them and they're addicted and they need help. So you look at these other countries, Portugal was big, but they offer people help. My understanding is it's still illegal to do these things in public. Giving out these supplies and funding the stuff seems like they read a pamphlet about it and then decided to throw money at it without actually investigating what it's going to do because it sounds good on paper.
I just watched Leanna Wen from CNN talking about how times are changing, the science has changed, and things are changing, and now we got to think about how depression and how despair is doing damage to people. So maybe this is a way to help people cope with their despair because maybe drug addiction is up. I wouldn't be surprised.
Well, sure. Joe
Well, yeah,
Biden's
drug
like,
deaths
have
are
a
up.
crack pipe.
Yeah. Well, and also throughout the pandemic, deaths from drug overdoses have increased.
Yeah. So is suicide.
Yes.
It's
Yes.
tragic. It really is.
But if it saves just one life, right?
Yeah, I love the fact checking
Yeah.
on this, though. Like you were mentioning, fact checkers, isn't it kind of crazy they're at that point where fact checkers, for the most part, obscure the facts to make it harder for you to understand what's going on?
Yeah.
That's
And the question is, what is their purpose and who is paying them? I dug deep into factcheck.org and looked at their corporate records, and they receive funding from the Robert Wood Johnson Foundation, which holds $2 billion of J&J stock, which is a vaccine manufacturer. The money they receive is earmarked for vaccine fact-checking.
what, really?
Yeah.
Yep.
So I taunted them on Twitter and dared them to fact check me on my facts on them. And so their fact checks didn't deny the fact that they were taking money from this organization that has $2 billion of vaccine manufacturer stock. They said that I was wrong because the vaccine manufacturer has no editorial control over what they say. But I never said that.
Right. And as if it matters, to be honest.
They owned the fact check program. I didn't
Yep.
say they had editorial
Man.
control.
What's the name of the company that's taking the $2 billion from Johnson & Johnson?
Robert Wood Johnson. They were started with Johnson & Johnson stock. It's one of the founders of Johnson & Johnson. And they say they're trying to diversify it, but the reality is they still hold $2 billion and they're getting money from that.
Do you know how much of it is earmarked for propaganda? Well, I guess if that's the right word.
Well, they give it to
That would be the
factcheck.org
right word.
and their entire program, which is probably not a big program. It's like one leftist reporter from Pennsylvania somewhere is funded with it.
And then they just pay for ads with it or something, like Facebook ads or...
They hire people.
Yeah, they pay this one reporter who's not a scientist.
So think about it. The taxpayers are funding the people to be in charge of what's information and what's misinformation.
What gets me is...
That makes no sense.
If you draw a 6 on a table and you ask one guy, what is that? He says it's 6. The other guy says it's a 9. And then the fact checkers come in and they get to decide which one of us is right.
And they get to decide who gets banned, who gets demonetized, who gets removed.
Yep. Well,
And then here's what I love about the science change, like that Leanna Wen woman or whatever. Is that her name?
Yeah.
Yes, that's a
On
CNN doctor.
She's like, the science changed, and now all of a sudden they're trying to reopen and end the COVID restrictions. My problem with this is we have a ton of studies coming out of India and Sweden that say certain things. So just leave it at that. That's not the science changing. Those studies are bad. Then all of a sudden, one study comes out and they say, "Oh, look, the science changed. We're going to change our policy." Like, whoa, what? No, they're picking and choosing what is the science. Apparently, Dr. Fauci himself is the science, and he decides, and then that's the direction they go.
yeah, I mean, if you criticize him, you're criticizing science. But
Yeah.
on the note of these fact checkers, when you look at Snopes, for example, a couple of years ago, there was a huge controversy where they were fact checking the Babylon Bee, which publishes satire articles. And part of the issue with that is it was actually demoting their content in the algorithm. And just to give you an insight into how honest this organization is, referring to Snopes, they doubled down on this instead of admitting that it was ridiculous to fact check satire. And they said, we conducted a study which showed that a lot of people believe these articles are real. Well, this is what they did. They took headlines that were obviously jokes and reworded them to sound like they weren't jokes. So one example was Democrats vow to close dangerous gun buying loophole known as the Second Amendment. And that was a Babylon Bee article. It was reworded by Snopes to say Cory Booker is one of several prominent Democrats to describe the Second Amendment as a dangerous loophole that allows people to buy guns. And then they asked people if they thought that was a real story. And when people said yes, they said, see, that means they believed the satirical Babylon Bee headline was true.
It's true. It's truly amazing, isn't it?
Well, they're in charge of the information, or at least they've put themselves in charge of the information. But just as Thomas was just pointing out, the taxpayers are funding them to be in charge of the information.
By the way, quick story. When the vaccines first came out, the Pfizer data, the top line data was out there, and the CDC issued a report and said that it was the vaccine data showed that the vaccine was 92% efficacious if you'd already had COVID. And I thought, well, that's a remarkable claim. And so I went and looked at the data, and it showed there was actually a negative correlation for those who had already had COVID if they took the vaccine. This is Pfizer's own trial data. So I'm a congressman. I called up the CDC, and they took my call. Surprising, right?
Yeah.
And the director in Washington, D.C. said, I'll get my top scientists on the line. I said, I think it's a typo. So she calls me back with their top scientists, and she said, we're going to call you Eagle Eye Massie. We don't know how we printed this. It's a mistake. We don't know how it made it in here. And I was like, well, okay, well, you're going to fix it, right? Oh, yeah, we'll fix it. And they said, so are you going to do an errata? Are you going to change the PDF that's up there? Like, I got into the technicalities. And so I thought it was all fixed. The vaccine comes out. Older people in Kentucky couldn't get it because younger people were taking it who had already had COVID.
But the data was never fixed.
The data was never, a month later, somebody said, oh, the CDC says this. I went back and looked. They never fixed the lie. And the lie is obvious. It's knowable today.
So you're saying there's a
Wow.
negative correlative data, meaning that after someone received the vaccine, or if someone had received COVID and then they got vaccine, there was less resistance than if they hadn't had COVID and got the vaccine?
It was minus 7%, but they had so little data, it's hard to draw any conclusion. Like the fact that they even claimed they could say it was 92% was ridiculous.
This is early on.
This was when the vaccine first came out. This was
early on.
December 14th of 2020.
Right.
Well,
as it's gone on, though, we've learned more. But really, the truth is, when they're talking about the science changing, like she was talking about on CNN, y'all, it has nothing to do with science. It's all about polling. It's about politics. And this is an election year. And this is why Democrats are starting to loosen up. We saw New Jersey taking away their mask mandates, other states, and they're easing off because they know they're in trouble. This is a major issue. Parents do not want their kids masked.
I will issue the obligatory talk to your medical professional about what's right for you.
Absolutely.
And data changes, so make sure you're double checking a lot of the stuff because we don't have anything pulled up. But YouTube is very, very gruesome these days.
By the way, I have recordings of those phone calls.
That's what I was going to ask you.
Oh,
Do you
did you publish
normally
them?
record everything when you make calls to these people?
No,
Are they always
I
recorded?
normally do not. It's not something I would ever do with another congressman, for instance. But
You publish them?
I gave them to Cheryl Atkinson, who did sort of an expose, and she picked the portions of the phone calls. I mean, there's like an hour of recordings because
Just
I had
publish 'em
5
raw.
or 6. I should just release them all.
Yeah, absolutely. Thanks for checking out this segment from the Timcast IRL podcast. If you want to watch live, you can check out this channel Monday through Friday at 8 p.m. And don't forget to smash that like button, subscribe to this channel, and if you want more unfiltered and uncensored content with all of these guests, go to timcast.com and become a member. All of these guests you know and love in exclusive segments on our website where we are unrestricted in what we talk about, so you'll definitely not want to miss it. Thanks for hanging out. We'll see you all next time.